produced. The only thing is, it's recent advances in medicine and surgery. The surgery bit's fallen off the bottom, which upsets me terribly as a surgeon, but not to worry. Now, I'm chairing the morning session. Our first speaker is from Oxford. We usually send directions for non-members of the RSM how to find us here, but I felt that a professor of geography didn't need that. So it's a pleasure to welcome Professor Danny Dorling, who is a professor of geography at the Oxford University Centre for the Environment, and he's going to talk about falling life expectancy in the UK, whether perhaps we should all be concerned about that. So thank you very much for coming. Welcome to the RSM.
Thank you. Thank you very much for allowing a geographer to be here. I think the invitation was originally to Martin McKee, my co-author on many papers about falling life expectancy. But Martin is normally somewhere else on the planet, for those of you who know him. So you've got me for half an hour. I'm also an honorary fellow here, so I knew how to find my way. Otherwise, I do tend to get lost. And I write about the UK mainly. The latest book is called Shattered Nation, so I'm afraid it's not going to be a very jolly half an hour. But I'm going to try and talk a little bit about the future as well, and just what we could achieve. But to achieve better things, we've actually got to realise what has happened, accept what has happened, the reasons for why it's happened, not some of the reasons that were put forward at the time. And it's really only then, I think, that we're going to be able to improve things very much. I've got quite a lot of slides for you, but I'll hang on this one for a minute or so, as it's the most important. What it's showing are the Office for National Statistics estimates and projections for life expectancy in the UK, for women at the top and men at the bottom. The dotted line from the year 2000 to around about 2012 is what had been going on, what's been going on for decades now, a steady, quite rapid increase in life expectancy, what we see in almost every other country in the world, due to a wide variety of factors that people argue about, but not just advances in medicine, not just vaccines, but also social conditions, nutrition, sense of security, pensions, and so on. Now that came to an abrupt halt shortly after 2010 in this country, but not elsewhere apart from the USA. You can see, if you read the text, how every 2 years the Office for National Statistics revised their future projections downwards based on what had been happening. The very first sight we got of this was around about the end of 2013, when we saw that the life expectancy of women over 65 had fallen by just 2 weeks. Now, that sounds very little, but we have a lot of women aged over 65, and so these numbers are not particularly random. There were issues about when winter falls and so on, but 2013 and 2012 figures were the first. Why women? And there'll be quite a lot of speculation here because we can't prove things. But elderly women are much more likely to be living on their own than elderly men. Elderly men, odds on, have a not quite so elderly woman with them. Why does that matter? Well, if Meals on Wheels are cut again, as occurred in 2010 to 11, if adult social services stop visiting because those members of staff are cut in local authorities, if the rural bus service isn't supported anymore, if there's 2 of you, it's much easier to cope than if there's 1 of you. The projections go forward to next year. But of course, none of that ever happened. We are on the bottom line. The little bar graph near me are the deaths that occurred directly because of COVID-19 by age and sex. Apologies, it's so small, but it's simply there to make the point, as you will all know, that this was a remarkable disease, is a remarkable disease, of course it's still here, in that by far the most important thing is your age. When it struck, I was 100 times more likely to succumb to it than my 21-year-old son, and I was 100 times less likely than my 80-year-old father. Enormous differences by age. And then secondly, by sex. Men were 50% more likely to die of COVID than women, despite being less likely to catch it, because men are not as good as being sociable and getting out. Over the first 2.8 years of the pandemic, we lost 15% of all men over 90 to the disease. 1 in 6. We lost 1 in 10 women. And that's a very dramatic thing, but it only moves the blue line down to the green line on that chart. Right. What happened before, which I'm simply going to call austerity, was far more devastating than the pandemic, and the pandemic was probably not quite as devastating. We have a record which is similar to other European countries, partly because so many elderly people died early before the pandemic occurred. So that's the context. There were arguments about this. They've kind of gone a bit quiet. The flu was blamed, a special kind of flu, a flu that only affects Britain and doesn't affect other countries. You can see my cynicism. We have a 10,000-word paper coming out about the flu. What I haven't measured about flu, I'm sick of it. But clearly, in hindsight, we didn't have a special flu that other countries didn't have. There was a bit of flu in 2015. There was quite a lot of flu in 2019, by the way. But 2019 was a good year because flu doesn't actually have that great an effect. It's probably the first thing I maybe shouldn't have said. Life expectancy for both men and women was lower in 2015 in the UK than it was in 2014. It was lower for both men and women in 2016, 2017, 2018. Slightly higher in 2019, despite actually having flu, and then the pandemic hits. Now we're the beginnings of post-pandemic. It's not just life expectancy, which is mainly a measure of the health of the elderly nowadays. In the past and in poor countries, it's affected greatly by the young. The situation for children is pretty awful. In 1990, the Office of National Statistics showed that we were 7th place in Europe for neonatal mortality rates. By 2015, we'd dropped down. The WH figures are still 3 years old, but currently our rates are only lower than Slovakia, Bulgaria, Croatia, Romania and Malta. And some of those places have Malta in particular, problems. Initially, this involved arguments about were we having people fly in for IVF? Was it Great Ormond Street? How many babies were surviving to 20, 22 weeks, stillbirths, all this kind of thing. That's kind of quietened down now. We desperately look for reasons as to, it can't be real. The second graph there, published in the Journal of this Society, shows the UK falling down the ranks of G7 countries. When I was born, shortly before I was born, we had the highest life expectancy in the world. There were 6 small countries, all with a combined population much, much less than the UK, that were slightly better, but essentially we had the best health for all kinds of reasons, not least wealth. We were still the relic of the heart of the largest empire the world has ever known. You walk around the streets around here and, this is why they look like they do. And of course we had a health service, officially established in 1948, although the facilities were the ones that had been there before. They're just better organised. The people were the people who'd been there before. But things got better. Social services were improved, pensions were improved, benefits were increased, housing was improved dramatically. Governments competed with each other to clear slums. Conservative government built more council houses than the Labour government. When I was born, I think I was born in a country with the lowest life expectancy, lowest infant mortality on the planet. We had the first baby incubators at the John Radcliffe in Oxford. Had I needed one, my brother did. He survived. Things were very good, and things are now not very good. But the good news, if you like, is that they are worse somewhere else. And because we look so often to the United States, we can often not realise how bad our situation is. The poorest fifth of people in the UK are living on an income lower than the average for the poorest fifth of people in most of Eastern Europe now. But we're a very, very unequal country. So we don't notice that because the poorest fifth, there are pockets near here. In this part of London, there are many more in other parts of London, but the bulk are living in the north of England, in the poor parts of Scotland and so on. Bruce Springsteen's lyrics are up there, if you want to see. And that, of course, that song was all about how bad the USA was. And became a favourite song in the USA to be proud of the USA, because rather like the USA, we seem to have a natural affinity to talk ourselves up, which allows things to get worse and worse and worse because fundamentally we're still great. And I think that is our problem. This graph was produced by John Byrne Murdoch, almost certainly the best data scientist in the UK at the moment, publishing in the Financial Times, almost certainly the best newspaper at the moment. I keep trying to go to Guardian to try and do better. It shows just how poor health is in the USA, because here we're comparing it to the UK, which not to a normal European country, but to a European country with poor health. And it's quite remarkable. If you really wanted a natural experiment to show it doesn't matter if you spend 16% of your GDP on health, if you spend it in the wrong way, you don't get the actual benefits. Only the very richest Americans manage to get themselves life expectancies that equal those of people living around these streets in this part of London. Not that far from here, the highest life expectancies are Kensington and Chelsea. There was a time a few years ago when they were rising by more than a year. Now, when life expectancies are rising by more than a year in each year, it tells you really interesting things. Either Kensington and Chelsea is going to become Mount Olympus, and they're going to be immortal, or something extremely strange is occurring. And that is partly what happened to us in Britain. Incredible polarisation, incredible migration of those who were healthy into some areas and those who were ill out occurred. This is the latest data. I received it a couple of weeks ago from the National Child Mortality data set, where they look at all the investigations. There are supposed to be investigations into all deaths of children, but the black line shows that the proportions we're failing to even investigate the deaths properly. But we have rising child and infant mortality. We had it in 2015, 16 and 17 as well. So high on the European level and rising. Now, one reaction to this is to say, but it's very low. Compared to 20 years ago, it's very low. And it's partly because we get this reaction that we don't do more about it. That reaction, I can quote him, was from Peter Bottomley at the time he was Father of the House, who just turned to me and said, as I was showing these figures in Parliament, but it is low, Danny, isn't it? The converse is if I show things like this in Scandinavian countries, and I make the mistake of saying in Finland, you've managed to achieve the lowest infant mortality rate the human species has ever known, people say, oh, we're still worried about it. Which is why it's so low in Finland. But it isn't low because of medicine. It's low because of an incredible social structure in Finland. Incredible equality. It doesn't matter what school you go to, they're all good. And by good I mean better than any of our schools in terms of what the children come out able to do. The number of languages that they can speak, read and write, their ability in mathematics and so on, but also social solidarity, and you don't end up having a child in a situation where it's likely that child dies. I can give you depressing statistics. Maybe the most depressing was the figure last year of a 20% rise in maternal mortality in this country. The main reason for that rise being an increase in suicides of young mothers or mothers-to-be shortly before or after their birth. And more generally, because of course mortality statistics are a tip of an iceberg, this is data that was published later on in The Lancet, our best estimates of the heights of our children. I haven't selected these specially, they chose these 4 countries. It dips slightly in Germany. These are 5-year-old boys. There's a slight dip in Germany. I suspect, because people often say, isn't this immigration? Well, Germany did allow in 1.5 million Syrians, including quite a lot of children, from a war zone. So I wouldn't be surprised if the slight dip in the average height of children in Germany might have been influenced by that. But we didn't. We didn't have an Angela Merkel who shed a tear and opened up the gate. We did the very opposite. If you look at the peak, it's 210, so these children were born in 2005. Whatever altered their nutrition that affected their heights occurred during the new Labour government, not helped by the coalition government of 210 with Liberals and the Conservatives, and certainly not helped since 2015. So if you like, this talk is a plague on all your houses for all the politicians that we've had. But this is a terrible situation to be in. You have to go back to the 1930s to find things like this. Or look at the United States and say, but don't look at France. France shows you what a country in Europe is doing at the moment, normally. Now, people may complain in France. They may say how terrible things are, and they may put on yellow vests. But partly because they complain, they actually ensure that things don't become worse. I'd love to know if their equivalent of this society begins at the age of 62 or not. That being, I think, still their retirement age, unless they lose it and it becomes 64. Official child poverty rates for the regions of England and Scotland, Northern Ireland and Wales. When I was young, the poorest part of the UK was Glasgow, the poorest of these was Scotland. Northern Ireland was doing particularly badly. Northern Ireland and Scotland now have the lowest rates of child poverty, lower than the southeast of England, excluding London. It's stunning. It's very sad. It's made my job remarkably easier. I used to have to look at complicated social statistics and make arguments that were nuanced. I don't anymore. This is just shocking. These are proportion of children living in households below 60% of median income. Median income is pretty low. Most complicated chart, I'm only showing you for one figure. This is the Resolution Foundation. The figure is the 56% in the top corner, which is the proportion of children with a brother and sister, 3 children in a family, going hungry every month. Properly hungry, not peckish. It's a majority. It's a majority now. We got rid of child benefit for the 3rd or subsequent children. That was just enough to tip it over. I've put up various mottos because I showed this, I think, at Eton. And it's about trying to change attitudes. My university's motto, the Lord is my light, is kind of like whatever I do, it's shining through me, I'm fine. Eton's, may Eton flourish and last forever, but, what else for everybody else? And that's my school, which was think for yourself and act for others. And it's about things changing, how things ought to change. Lots of things are beginning to get better. They're beginning to avert, but we are at a peak of inequality, a higher level of income inequality than any other country in Europe has, a higher level than we've seen since the early 1930s now. I was born into the 1%. I'm a very posh boy. I might have gone to a normal school with a motto that said, think for yourself, act for others, but I was born into the 1%. My mother and father's income put my family into the 1%. We were incredibly privileged. So what job did my father do in the 1960s and early 1970s to put me in the 1% above everybody else almost? My father was a general practitioner. because GPs were paid more then than almost anybody else, certainly more than most bankers. Somebody has to be in the 1%. I quite like doctors, as being the son of one. It made sense. Now, of course, GP salaries then were not particularly high over what you could do. You couldn't fly to Italy and have a holiday in the summer, but you knew you weren't badly off. We had 2 cars. But that was the most equal we'd ever been. And then the inequalities rise and rise and rise, and so, in a sense, doctors begin to feel worse off, even though they have pay rises, because other people move above them. No GP could live in the house I grew up in now, in Oxford. I couldn't buy it. I'm just a senior university professor. But then it was possible. I won't read that out, but it's just part of what's been going on. All the pay deals that I have been able to find in both the private and public sector have all been progressive in the last 2 years for the first time in 50 years. Those getting the least have seen the biggest increases, such as nurses, hospital porters, low paid telephone engineers, lower grade civil servants. Now, it's not an increase for them, it's a 12% reduction since 2008. But top civil servants have had a 25% reduction. The sad thing about the good news is it tends to be bad news, in that you're all better off. When we were last this unequal, 1920s, the incomes and the wealth of those at the top fell faster than those at the bottom. We got a much better society in the end as a result, but nobody celebrated what was going on. This is the Gini measure of inequality in income, probably the most important single summary of how divided your society is. You can see, if you've got very good eyesight, we're starting in 1960, that it was very low, became even lower in the 70s. Only Sweden was more equal than we were. We were essentially a Scandinavian country in the 70s. You'll all know about the huge rise in the 80s. Those who had most got more. What you may not be aware of is that it plateaued completely. Nothing improved. The error on the survey is over 1%, and so all those little ups and downs are random movements on the DWP survey used for this. Right, we've gone up to maximum inequality in Europe, and we've stayed there. And it erodes. It's like having high blood pressure, he says, going into sticky waters. Right, bad to have high blood pressure for a year, even worse to have it since 1995 continuously. That's kind of what's going wrong in our society. That's the measure for all the European countries. We're the red one at the top. Turkey, occasionally Bulgaria are worse. Majority are actually dipping down slightly. They're much lower than us, but more European countries are becoming more equal than unequal at the moment. And they are the most equal places in the world. It's a bit like the far right, which are actually falling in more countries than rising, but we only report the rises, so you all get to hear about the Netherlands, but nobody writes stories about Golden Dawn dying off it in Greece. This is a cartogram of Europe, coloured by how unequal the countries are. There are 5 countries in Europe outside of the Nordic 5, that's Iceland, Denmark, Finland, Sweden and Norway. 5 countries that are more equitable than the Nordic countries now. And another 5, including France and Germany, that are within a whisker of being as equal by income. So we have a kind of block of 15 countries in the middle of Europe, which are incredibly equal by global standards, surrounded by the UK, Russia, Turkey, and so on, which aren't. This is another way of looking at it. This is all the countries the OECD report on. The red bar is Finland. 4 countries separate Finland from France and Germany. You see how close they've become? Then you've got Spain, Italy, I've picked out the big ones, and we're blue. Right next to the United States, slightly more unequal than Israel, including everybody in all the territories. I wrote a book on Finland with Anika Koljonen. She was about 21, 22 years old at the time we wrote it, but she'd been to school in Finland. Her English is better than my English. But the positive side of this and because I've only got about 8 minutes left, is so much is achievable. You know, I don't know what you do if you're Finland now. What do you do when your schools are at the top of the world rankings? What do you do when you have no homelessness on the streets? What do you do when you've got affordable housing for almost everybody? What do you do when you can pay your medics less than we pay in Britain? Because the cost of housing is so much less that it doesn't matter. Their health service costs far less in Finland as a proportion of GDP than ours does, because the rest of society works. And I'm very glad I'm not working in Finland, because I really don't know what do you do next. Hopefully they'll think, but it's tricky. And of course everything is not rosy in Finland, but adversity may have helped them. Never having had an empire, in fact having been a colony, sitting on the edge of Russia during the Cold War, having to act together, having to have solidarity, having to do things to stop the population constantly emigrating, deciding at one point to spend more money on the bottom quarter of children in schools than any other. Imagine if we did that. Imagine if we spent more on the quarter of children doing worse at school, what the result would be. What do we do? And this is me worrying about things. We're very good at banking still. Our banking sector has actually expanded a little bit since Brexit, but it is deregulated banking. It's the kind of banking you wouldn't be allowed to do in Europe. When it works, it works, but it's not necessarily a firm basis. We are now the centre of the largest online gambling industry in the world, not per capita in total, bigger than the USA. Gordon Brown brought the taxes down to zero, which helped that. And the third one, which I don't tend to put up because of loyalty to my profession, is education. Overseas students is our third biggest export earner. Bigger than the arms industry. So you can see I'll try and get, in the last 5 minutes, more optimistic about these things, but you can see the pessimism. There comes a point when you have to say it went wrong. Now, Thatcher didn't want it to go wrong. Margaret really believed things were going to get better. She signed up in 1986 to the World Health Organization targets to halve inequalities in health between areas and between social groups by the year 2000. Margaret Thatcher honestly believed that her policies would do that. She wasn't vindictive, she wasn't being nasty. She thought that trickle-down, spreading the wealth, increased entrepreneurialism would create a more equal country. I believe it. But when it becomes obvious it doesn't, carrying on with the same mantra, you have to stop it at some point. There are other ways in which we've switched. I know this becomes more political, but the medical is political. You don't explain our position in the health ranks by something going that terribly wrong with our health service. Our health service, of course, is in disarray. In some of those years that I quoted earlier, we did no operations in hospitals for weeks, if you remember. But it isn't that. That isn't the core of what goes wrong. This is a map of people voting Conservative across the European Union in 2014. And you notice the UK isn't there, because we no longer had a Conservative Party at that point by the standard European definition, which means a member of the European People's Party. Our Conservative Party had joined with Alternative for Deutschland and other far-right groups at that point. We don't think of ourselves like this, but this is partly what happened, which partly explains why we're so much more like the USA than like the rest of Europe when it comes to health. These are the public sector workers disappearing over time. These are ONS measures. It's very complicated because who is and isn't a public sector worker? I work in the private sector, by the way. Our universities are fully private. But somebody in a further education college would have been private about 15 months ago, but now they're part of the state because we nationalised all our FE colleges last year, quite quietly. The ways in which you solve these things, they don't have to be loud and shouty, always. What happened with the further education colleges, they were getting into a terrible mess, is that the Office of National Statistics decided that they should no longer count in the national accounts in the private sector, but because they're receiving so much government money, they should be classified as part of the state. On the same day as ONS made that completely independent decision of government, the minister wrote a letter to all the heads of further education colleges telling them that they were now part of his department and not to borrow any more money. And implicitly, although it's never said, to stop paying themselves more than the Prime Minister. Because if you're part of the state, the unwritten rule is you don't have a salary higher than the Prime Minister's. These are nurses and junior doctors from the FT in comparison to what happened to average wages, because if you cut the size of the state or what the state can do, these are the kind of salaries that you will be impacting upon in the living standards. And one more slightly complicated graph for you. Again from John Byrne-Murdoch, just trying to explain the international situation with health staff. 3 months ago, maybe 2 months, I met a woman on the banks of the River Cherwell. I was kayaking with a friend. I asked her if she wanted to come with us, and she said yes, so we got her in. I then asked if she could swim, and she said no, and I worried slightly. I thought she was a student. But we worked out we were fairly safe. It's only that deep in the Cherwell. I said, "What are you doing here?" She just said, I'm a nurse. They flew me out from Lagos. I've been here for a year. And I began to realise she was wandering around because her rent was the same as her pay. She was very, very, very proud of working at the John Radcliffe Hospital in England. She'd never been to England before. She'd never been to London. She had been on a river. She couldn't swim. Right, that's how we're just keeping things going. Why? Because we tax less than everybody else taxes. Simple as that. We might have the highest taxes for 70 years. They're still less than what is normal on the European mainland. Right? You can't organise yourselves collectively unless you organise yourselves collectively. Just about 5 more slides to go on. Here's public spending since 1980. Now you'll see in general it rises because we're getting older. We can't have children on the streets being destitute. There are things we have to do. The first fall is Margaret Thatcher. We got little rise for New Labour. We have a great big rise for the banking crisis, and then a huge rise for COVID. Right? All these events that affect public spending. But the key thing is how does it compare? Oh, and by the way, because it's up there, that's your highest taxes in 70 years. Because public spending is essentially taxation, give or take a bit of borrowing. Here's the other 4 large countries of Europe. There's France at the top, where their children aren't just getting taller, but getting taller faster than they were a few years ago. Germany is the one we should aim for, I think. It's realistic. It's not that maverick. It's possible to do. It's the black line in the middle. You're talking several entire health services in difference between those lines. In Germany, they spend 1,050 million more a week, $1 billion more a week on their health services. If I had enough money to hire a bus in 2016, I'd have hired a bus with $1 billion on the edge of it and said, let's be like Germany, not 350 million. Here's the rest of Europe. We're missing out Ireland and Switzerland. Switzerland because of the pharmaceutical industry, Ireland because of the Americans. Their companies are in Dublin. Right. We've got loads we can do. There's enormous scope for doing things differently. I'm aware of time, so I'm going to click forward again. David Cameron, do you remember him bringing in the happiness measure when he hugged the husky? But it's really good he did. I like these measures. He instructed ONS to measure the nation's happiness and several other things, life satisfaction, are they worthwhile? He did it in shortly after 2010. Took him a bit of time to get the measures worked out, but here they go, and you can see they're actually going up. Right? David never checked. He could have claimed he'd made everybody happier. They went up partly because we were coming out of that banking crisis, which was very scary. Right? But they also went up, I think, after 2016 because 52% of people got what they wanted. The other 48% thought they were going to get what they wanted, because normally when people vote the way you don't want them to vote, you don't let them have it. 500,000 people joined a political party with a new leader in 2015. it was actually quite a happy time. It may not have felt happy, but this is scientifically measured. And then something truly awful happened around the summer of 2019. September 2019, October 2019, November, that's when they're coming down, particularly December 2019. Absolutely devastating on the mental health of the people of Britain. That blue line is February, early 2020, when we realised something going on in Wuhan was going to affect us. Not as devastating as whatever it was that occurred at the end of 2019. The second peak, I'll show it on the next one, anxiety. I mean, this is stunning. Quite incredible how political and social events can affect the mental health and the health of people. You've got your own stories, if you can think of those months. This is the proroguing of Parliament, the forcing of an election was what was going on. It's hard to think of something else that could have had this effect. People really were interested in politics to create that first peak. Then we get the pandemic, but anxiety is already so high, and people thought it was going to go. That second peak is wave 2, with the realisation of, oh no, this is going to carry on, it's serious. And then it falls, vaccines, and so on. And you adjust, you get used to the shock of what's gone on. My last slide. So please think of any questions that you've got. It's a depressing story, but you lot have worked in medicine, so I don't tell it this way to other audiences, particularly not this way to youngsters and to children. I put in many more positive things, partly because I believe that for most of their lives, things will probably improve in terms of these gaps between us, the things that are necessary. But you've dealt with much worse situations than me in most of your working lives, so I thought you could take it. But it's just not good. It really is not good. And we have to accept that we have fallen to the bottom of yet another European league table. And I'll end on one criticism I get when I show that data for neonatal mortality, and I show that countries like Romania are still a little bit worse than us, but it's going up, is people say, why do you think it's okay that Romania is doing so bad? Right? Whereas, of course, I'm naturally used to this. We should be at the top. Right? You can't always be at the top, but we could be in the middle. We have the wealth, enormous wealth, knowledge, experience, structures, benefits of history, all kinds of reasons why we don't have to be at the bottom of the European league table. I think our biggest problem is that we're led by people who think we should be at the top as fast as possible. That's our rightful place. And because they think we should be at the top, they enact policies which actually help keep us at the bottom. Thank you very much for listening to me.
Thank you very much, Professor Dorling. Not a happy story. Can you factor in Brexit to any of these disastrous trends?
We've tried to. The big problem was the pandemic. Pandemic coming along. 1 in 3 midwives in the middle of London were EU but not UK citizens when Brexit occurred. That was a big fear. And the other fear was that we knew we'd been getting incredibly healthy migrants because only us, Ireland and Sweden opened up in 2003. We got the people with most get up and go. It's really clever. And there's a worry that when they start to return, then that will alter the health of the population. If you lose your healthy migrants, and kind of even worse, if you have your unhealthy people in the Costa del Sol coming back, that could be bad. The problem is that the pandemic meant that people very quickly moved to where they were used to being, and so it's hard to work out. There is no way in which it has been beneficial. I think that's the safest thing I can say.
But happiness was falling before the pandemic, yes? And anxiety was rising.
Oh, yes.
And that was a financial thing?
No, that was, although Johnson and the Conservatives got a landslide, that landslide was a minority of adults, a minority of voters. Those who didn't want it became increasingly distressed in the months leading up to it. But also, quite a lot of those who voted that way were not happy with their lives. They were petrified of small boats, sick to death of this ongoing to and fro, but it wasn't a triumphal thing. That's what I want to get over. As far as the statistics on how people felt, ideally we'd have some data that goes back to 1945 and we can, but again, a war had ended. Or 1997 or 1979, which were similar big elections. Elections are not that important, though. When you're looking at the health trends in Britain, and I've drawn graphs with dots for every election, you can't see the elections having any effect because all your political parties move together. They moved in the 1930s. It was a Conservative Minister of Health, Wilkes, was it? He was important in creating the NHS. Beveridge was a liberal and a eugenicist and a misogynist, but Beveridge still was helpful, very helpful in creating a welfare state. All the political parties moved progressively. Then they all move to be what I would call not progressive. And we argue about the differences between them, but the differences are incredibly minor at any point in time. The question now is, can they all move, ideally led by the Conservatives, because that would be the quickest way, into a direction towards something which is more normal, both for the continent we're on and for our history. And for short-term political gain, if the Conservatives wanted to do well at an election, actually deciding they were going to do some policies to make life better for the majority of people might help them. But I'm an optimist. You can see, I do think things are possible. I can imagine.
We've got one
go
or
on,
two questions.
let's do them.
Could I just ask one question?
Thank you.
Yes.
You mentioned the health expenditure in Germany. Of course, Germany has privately funded health insurances, very well organised. Do you think we should be following their example?
We are in a way, but not well organised. So 1 in 10 people in Britain used private healthcare last year. This is a massive proportion. But it's a not well organised system. Finland doesn't, and does better than Germany. But I don't think we should be too entirely precious about how we do it. We raise part of our taxes through something we call national insurance, but essentially it's a tax. And we should also not be too hung up about the amount we spend, because we spend more than Finland, and Finland spends less than Germany, but has outcomes that are improving much more quickly than Germany. So it is just as important, if not more, that your housing stock is good, so that you don't have medical staff striking so they can get a decent home. If you have decent homes for the entire population, that stops being an issue. In the city of Oxford now, when I was young, car workers could buy 3-bed semis. Those 3-bed semis you can only buy if you're an associate professor on a high salary with family money and an inheritance. And you're buying the 3-bed semi of a car worker in the 70s. So it's a very valid about how we fund, how we organise a health service. But what will make it work is if, when they go home at night, the staff can simply be in a nice house, not having to share. Doctors have to share houses, young doctors in Oxford, which isn't fun in your 30s.
You mentioned migrants. Do you think that changes in migration status could be responsible for some of the trends that you've mentioned, such as inequalities, inequities, differences in heights that have occurred?
It's a really big project to use a longitudinal study to look at this. This is 1% of people in Britain, which includes their immigration records and sometimes emigration. Although most people will never say they're emigrating because they think they're not. They just meet somebody on the beach and never come back. And we're now switching to an immigration system which is guest workers, where people won't have the rights. my gut feeling is that the immigration has almost all been beneficial. Not just beneficial in actually creating the people who work in the health service, but the migrants who have come have tended to be healthier. Work from the LS tends to show that for all migrant groups apart from Scots and Irish, who in the past, in the 70s and 80s, were not. But that was then, and this is now. But moving to this guest worker system, where you come but you don't have full rights and you've got to go again, that's not good. The worst situation we could get is what Singapore has. Singapore has what looks like an incredibly low infant mortality rate, but the servants aren't allowed to get pregnant. Or if they do, you have to pay the cost of the birth as the employer of the maid. And so Singapore is not proud of its record. There is a danger, if we carry on the track we're going on, that we become Singapore on Thames. We have a mass service class of people from overseas who, like our servants in the past, the most common job for women 100 years ago was to be a servant, Theresa May's grandmothers. You can't have children as a servant. That's why people hated being servants. You couldn't start a family. And that is I don't think we're going to do this. It's not in the interest of 99.8% of people. But that is currently where we're heading.
Another question?
Thank you, Danny. Pleasure to meet you, and thank you. Can I ask about the impact of the 2012 Health and Social Care Act? We had been promised no top-down reorganisation, which gets in the way of patient care. I remember being in this building when Stephen Hawking was talking, and somebody referred to the fact they'd thrown a grenade at the NHS. And just as a sort of follow-up, the fragmented nature of social care, which I know GPs are forever picking up on social problems. Half their time, more or less, is taken up with life problems rather than medical issues, which I totally sympathise with. But thank you. The 2012
Act, yes. Andrew Lansley, who I think even Andrew said he began to regret parts of that. But it was, the Lords pushed it through as well. I remember being very upset with Shirley Williams at the time. Apologies if I got that wrong. Yes, it was the end of the experiment. This experiment since Thatcher of markets, deregulation, the responsibility disappears from the Secretary of State for Health, it's devolved, and it'll all work out somehow. Now, I'm not saying that we need a Stalinist system again, the kind of system we did need in the Second World War, which we in effect carried on afterwards. But certainly, and by the political parties who introduced it, they in effect have accepted it was a mistake by the Act of last year. But if you're going to read one book on this, Gavin Francis's book about the NHS is stunning. A Scottish GP. It's called Free for All. Tiny little book, Free for All, published this year by Gavin Francis. It's about the reality of what happens 10 years after that. But what I'm trying to argue is it wasn't one thing. And it wasn't any, in particular, the three main political parties. And you can tell which party I vote for, but the party that I'm quite loyal to has made enough mistakes of its own with the health service, and in the short term, it's crisis management, and starting with adult social workers, other social workers, care homes, simply having somewhere to dispatch people to, but it's connected in that. When you can't discharge somebody because you're discharging them to a 3-bed semi on their own, but they don't often actually want to be in that 3-bed semi on their own because they can't afford to heat it. They just want to be near their relatives. So what they need is an apartment near there. You give them an apartment, you can discharge them, and another family can live in the 3-bed semi, which was built for a family. So you have to do it all. Yeah.
I think we'd probably better bring this discussion to an end. Thank you so much, Professor Dorling. My goodness, rather a worrying series of trends. Thank you, sir.